This is code short video number 4, part 2. In just 2.5 minutes, let me show you some additional outcome measures that might be helpful for your practice. So in part 1, we looked at current capability. In this part, we're going to look at expected function or expected capability. These are outcome measures that can help you predict where the patient is going to be after the treatment or in a few months, what have you. So the PSFS is a pretty easy questionnaire. The one trick is that it's interactive, meaning that you have to walk the patient through the process of the questionnaire. So when I've used this with patients in the past, they've said things like, my goal is to climb Mount Everest or water ski, when they've never hiked and never been on a boat. So they tend to make these crazy expectations or these crazy goals that don't make sense. It's your job as the person giving the questionnaire to back them up and say, you know, maybe we should work on an easier goal, one that's more attainable. Can you walk around the block one time without having to stop for a rest? If the answer is no, that might be a good short-term goal for them to achieve. And again, you're going to take that information, and once they achieve that goal, you're going to write down how the prosthesis or orthosis helped them get there. So the PAVIT is a weird one. It's not validated scientifically, and for right now, you can only use it for MPKs or microprocessor controlled knees. The thing about the PAVIT is that insurance companies, specifically Blue Cross and Blue Shield, have adopted it and have actually licensed its use, and it gives a number, and we love that. So if you look at the number in if you've evaluated the patient, you've got reams of information, the PAVIT will take all that information and say, the score is 62, meaning they're a candidate for a microprocessor knee. It takes all that information and narrows it down to just a number, which is great for the computers at the insurance company. So if you want to get your hands on the PAVIT, all you have to do is Google PAVIT. And then if you want to get the scoring guide, you just Google PAVIT scoring. So unfortunately for us, it's another thing that we have to do to integrate these outcome measures into our notes. The thing is, everybody's doing it. The reason everybody's doing it is because insurance companies are requiring it. Not just for us, for every kind of healthcare provider there is. And again, if you need help, that's what code is here for. If there's an outcome measure you want to use but you don't understand it, shoot us an email, we'll look it up and give you the information. If there's one that you've received and you don't know how to interpret the results from the therapist, again, send it over and we'll get you all the information you need for it. Likewise, if there's information you want to gather but you're not sure what outcome measure would get that information for you, send that question to code. That's what we're here for, to get you that answer.